Hello everyone, I am Samima Banu. Today I am going to present about Syringomyelia. Introduction. Syringomyelia is a chronic neurological disorder that occurs when a fluid-filled cyst called a syrinx forms within the spinal cord. The lower cervical segments usually affected, but the extension occurs upward into the brainstem. The cavitation appears to develop in association with obstruction. Frequently associated developmental abnormalities: vertebral column, thoracic scoliosis, fusion of vertebrae, base of the skull, platybasia, and basilar invagination. 90% of cases of Syringomyelia have type 1 Chiari malformation. Chiari malformation is nothing but the part of cerebellum extends into the spinal canal. Types. It has three types. First one is congenital. It is associated with the Chiari malformation. And next one, acquired, due to the spinal cord tumors, traumatic myelopathy, spinal arachnoiditis, and patchy meningitis. And the third one is idiopathic. The reason is unknown. Classification. Depending on the connection with four ventricles, it is classified into three: communicating, non-communicating, and extracanalicular. Clinical features. Sensory. Dissociated sensory loss in either or both arms or shawl-like distribution. Dysesthetic pain, a common complaint in Syringomyelia, usually involves the neck and shoulders. When the cavity enlarges to involve the posterior columns, position and vibration sense in the feet are lost. Motor. Syrinx extension into the anterior horns of the spinal cord damages motor neurons. It causes diffuse muscle atrophy that begins in the hands and progresses proximally to include the forearms and shoulder girdles. Claw hand may be developed. Respiratory insufficiency, which is usually related to changes in position, may occur. Autonomic. Impaired bowel and bladder function usually occur as a late manifestation. Horner syndrome may appear, reflecting damage to the sympathetic neurons in the intermediolateral cell column. Painless ulcers of the hand are frequent. Edema and hyperhidrosis can be due to interruption of central autonomic pathways and neurogenic arthropathies like Charcot joint. Diagnosis made by X-ray of cervical spine, 3D CT, and MRI. Treatment. Analgesics for headache and neck pain. Surgery. Suboccipital and cervical decompression, laminectomy, and syringotomy. Neuroendoscopic surgery. Shunts. Ventriculoperitoneal shunt, syringosubarachnoid dorsal root entry zone shunt, syringoperitoneal shunt. Physiotherapy management. Increasing muscle strength, usually upper extremity and paravertebral muscles. Maintaining range of motion using stretching. Mobilization of the neck and upper limb, training neck stability. Thank you everyone for listening my presentation.